Welcome to Team E's presentation on Alzheimer's and dementia. This is the final. Alzheimer's disease and dementia affect millions of Americans every year. Alzheimer's is the most common type of dementia, affecting 5.2 million Americans, compared to 1.5 million Americans in 1985. Adults 65 and older run the highest risk, and the risk increases with age. In 2014, there will be 469,000 adults 65 and older that will develop Alzheimer's disease. From 2000 to 2010, there was a 68% rise in the deaths from Alzheimer's, while other diseases such as HIV, stroke, heart disease, and some cancers saw a decline. Morbidity from Alzheimer's disease can come from results of brain injuries stemming from not recognizing strokes and falling. Diminished motor skills can lead to fatal injuries, difficulty chewing, and an increase in susceptibility to infections. Currently, Florida has the highest rates of mortality with 4,831 deaths, a rate of 25.7%, while Alaska has the lowest with 85 deaths with a mortality rate of 12%. Alzheimer's is the sixth leading cause of death among Americans and the fifth cause of all adults. Women and Alzheimer's. Studies show that women live longer than men. That contributes to the high numbers of women that are affected by Alzheimer's. 1 in 6 women versus 1 in 11 men. Women also tend to be the primary caregivers to people that develop Alzheimer's or other types of dementia. The remaining lifetime risk for women over 60 developing breast cancer is about 9.3%, while the risk for developing Alzheimer's is about 17.2%. So what's some of the biggest risk factors? Age is the biggest risk factor. Getting old. All the studies show that 65 and older, the risk increases each year. Hereditary. Those who have a parent, brother, sister, or child with Alzheimer's are more likely to develop the disease. The risk also increases if more than one family member has the illness. And scientists have also narrowed down the genes that can lead to Alzheimer's. So how do we battle the disease? Currently, no cures are available, and many people go undiagnosed for years, allowing the disease to progress. Adults over the age of 65 need to have routine visits with their physician to help diagnose any early signs. Although there is no cure, there are some medications that can help fight against memory loss. Diagnose and investigate is applied to this health problem to ensure the diagnoses are accurate. There are a number of mental health issues, and there needs to be a correct diagnosis of dementia and Alzheimer's disease and no other mental conditions. Investigation takes place through censuses, medical diagnoses, and comparisons of symptoms of the disease against symptoms of other diseases. Many times there can be an appearance of dementia or Alzheimer's when it might not be the case. So let's address the issue. The Legacy Project was created by the University of Alabama to help patients of dementia improve their mood, reduce depression, and engage socially with other people suffering from the disease. The Legacy Projects help communication through pictures, cues, or mementos from the resident's past life, and often not only focus on the past, but the present as well. Another program used in Alabama is known as Restore, Empower, and Mobilize Therapy, which is also used for patients of dementia. This therapy involves various projects and activities that incorporate family members and caregivers. These programs not only help the patient with dementia cope, but the family members and caregivers as well. Community involvement. The University of Alabama has conducted clinical research on dementia and Alzheimer's and have developed programs such as the Legacy Project to assist not only patients but the families and caregivers. Dementia and Alzheimer's can become very difficult for the family members and caregivers as they watch their loved ones' mind, memories, and personality come and go and eventually disappear. Caregivers with a multitude of stressors from helping with self-care to manage finances. It should also be noted that almost half of the people with dementia that are cared for by family members or caregivers at home experience some form of mistreatment. With the Legacy Project, both families, caregivers, and patients learn to cope with the chronic and life debilitating disease in a meaningful way through pictures and mementos of the patient's life. So, what's being done? There is currently no cure for dementia. However, there is constant research being done, just as there is with any other disease. Annually, the National Institutes of Health spends roughly two-thirds of $1 billion alone on Alzheimer's research. With research, there have been findings of certain drug therapies that assist people with dementia and Alzheimer's. These therapies often can help slow the cognitive decline that is prevalent in dementia and Alzheimer's, and can sometimes even delay institutionalization or the need for a caregiver by improving how the person functions. Policy development. New policies to address the issue of dementia and Alzheimer's include early detection. That can be going to your physician, your loved ones, taking you to your physicians to ensure that any symptoms are checked out to ensure that you don't go undiagnosed for years, allowing the disease to progress. Proper diagnoses. Again, Alzheimer's research is relatively new in the grand scheme of things. Back 30 years ago, they would just say that person is senile, that person's just crazy. They actually were affected by Alzheimer's disease. There just wasn't a name for it. Now we have a name for it, so we are properly diagnosing individuals, which can be why the numbers have increased so dramatically in the last 30 years. Also, further research on medications and therapies to assist the people that are suffering. Potential facilitators and stakeholders within the communities of the state of Alabama should be all health facilities, with special emphasis on long-term care settings, such as nursing homes and personal caregivers. Since dementia and Alzheimer's are so debilitating on one's state of mind and cognitive functions, they often cannot complain about the care they receive or issues they have. When they do, it may just be disregarded due to their medical condition or state of confusion. The majority of people suffering from these diseases are elderly, and many of these people reside in nursing homes. The quality of care is often questioned in many of these facilities due to lack of staffing. Because staff is so overworked, low workforce retention, lack of technology, and reliance on Medicaid funding. So it is essential that nursing homes, administrators, and directors are involved, aware, and educated on current treatments for this type of patient. In order for a person living with Alzheimer's to have a sustainable life, they must be receiving quality care regardless of location. Non-pharmacological therapies such as the Legacy Project and other social activities are essential in giving an Alzheimer's patient a sustainable life. Inform, educate, empower. Education is very important when it comes to Alzheimer's and dementia. Providers, whether a family member or caregiver or a nurse at a nursing home, need to be trained as well as educated on how to interact with and give quality care to a person with Alzheimer's. Professionals especially need to be well trained. From diagnosis to treatment, all these have an effect on the quality of care a patient receives, as well as allowing this person to live with dignity and according to their values, regardless of cognitive function. So we need to identify and promote culturally appropriate strategies designed to increase public awareness about dementia. We need people to know that this is an actual problem, not just the family members who are affected by it, but also everybody else from the outside looking in should be aware. We should develop strategies to have the service available to everybody. Early detection. If people are poor and they're not able they should be they should be allowed the same rights as anybody who can't afford the care. Getting involved. It is critical that not only local communities bring Alzheimer's and dementia awareness to the forefront, but it is also crucial that individual states and the government work together. By working together, they can create financial incentives to integrate healthcare and long-term care for people with dementia. The cost of Alzheimer's and dementia care is an estimated $100 billion a year, with Medicare and Medicaid paying a substantial amount. It is also costing the economy, as the loss of employees that are caregivers is costing businesses an estimated $33 billion a year. Besides the various governments partnering together, it is also important for owners and administrators of nursing facilities to educate their staff and how to identify the needs of Alzheimer's patients. Elder abuse is becoming more and more common, and Alzheimer's and dementia patients do not always have the means to communicate the misconduct. All facilities should provide clear job descriptions, job responsibilities, and expectations, and hold staff accountable for their performance. Enforce, protect health, and ensure safety. The National Alzheimer's Project address and overcome the Alzheimer's crisis. It was signed into law on January 4, 2011, calls for national strategic plan among federal agencies to address and overcome the rapidly escalating crisis of Alzheimer's disease. The Advisory Council on Alzheimer's Research, Care, and Services monitors implementation of the national plan and recommends changes for annual updates of its activities. Supported by congressional appropriation beginning in the year 2005, the CDC established the Alzheimer's-specific segment of the Healthy Aging Program, referred to as the Healthy Brain Initiative. CDC partnered with Alzheimer's Association, and together they engaged other groups, including the National Institute on Aging, the National Institute of Health, Administration on Aging, the AARP, and other public and private sector organizations to launch the activities of the Healthy Brain Initiative. Together, these organizations embarked on a deliberative 18-month process to create a roadmap guide, coordinated public health response across organizations. The Healthy Brain Initiative, a national public health roadmap to maintaining cognitive health, offered a synergistic model for moving science into practice based on several principles. Linking people to the services. Link people to needed personal health services and ensure the provision of health when otherwise unavailable. Awareness can be achieved by providing public health information and data regarding cognitive health and impairment to national reports. Care, planning, and advanced financial planning for those affected by Alzheimer's and dementia in early stages before function declines is essential. Assure, keeping a promise. Although there is considerable variation in structure and organization, each state has a Department of Health. The coordination of contributions by private, non-private, and governmental partners may provide leverage for synergistic opportunities. As cognitive health continues to gain recognition as an important public health issue, state and local public health professionals will be called upon to translate current and emerging research into practice. Evaluate and improve. Evaluate the effectiveness, accessibility, and quality of personal and population-based health services. Standardize. We should be standardized across the country. Alzheimer's isn't more important in one part of the country than in the other. It affects us all, and we all should be standardized. And then improve the quality of life for those affected by Alzheimer's. The long-term goal of the Healthy Brain Initiative is to maintain and improve cognitive performance of all adults, and can only be achieved through collaborative and effective partnerships at national, state, and local levels.